and we would wish you to go and make your opening remarks, and then I will then ask members to start sending their requests to me to field questions to the Minister. Honourable Minister, we give you now space to speak.
Thank you very much, Honourable Chairperson, honourable members. Let me start by saying thank you to all of you that I did get lots of messages from honourable members, and some members sent me flowers and all sorts of nice messages. I must really say that it was quite touching, and I want to say thank you very much for that. And I think for us all, the Monday was also a particularly exciting day when we received the first consignment of our vaccines. We have all indicated that with this pandemic, one of the major forms of prevention is the provision of vaccines to be able to create immunity amongst our people so that they can on their own be resistant to this very viral infection that is quite virulent in some instances, causing loss of life, as well as severe illness, hospitalization, and a huge pressure on our resources and health services. I accept your approach, and I'm going to try and keep it short, so about not more than 10 minutes, just to walk through the issues. But just to say as well, I think this approach is very helpful because then we can focus on the questions from the members. The approach that we are taking here, I want to assure the members here that it's a very difficult terrain to manage the issue of vaccines because of the fact that the global demand is same for every country throughout the whole world, and therefore everything is happening at the same time for every country, and so that really creates its own dynamics. Nevertheless, I still believe that as South Africa, we are on course. We have not lost time in the context of the fact that we will be starting our vaccination soon. We did say that we will be having these vaccines for the next 10 or 14 days, and then once that is cleared, we should then be able to proceed with the vaccination program. I think we must also recall that part of the things, the issues that have to be balanced has been the fact that not all the vaccines have had all their results out, and therefore we have to tread carefully in the area of how we approach the management of the vaccines, so that everything must be all aligned by the time we actually get to the vaccination. And as we move on, there are obviously lots of moving parts in this whole issue. But nevertheless, we still are committed to vaccinating up to about 40 million people in South Africa. That process, we'll do everything to ensure that they are vaccinated. We are aware, though, that there may well be challenges of the global supply, and the countries that have paid for vaccination for 3, 4, 5, 6, 7 times their population needs. They're also struggling because of the blockages or bottlenecks in the vaccination, in the vaccine production process. So we've even seen, the whole huge amount of resource nationalism, where in the US and in Europe, there have been calls now, in some instances, enforcement that there can't be any exportation of vaccines unless the local populations have had their needs already fulfilled. And so it's a worrying issue there. We have set up the structure, and the structure at this point it starts now with for the cabinet. President has set up an interministerial committee led by the Deputy President with a number of committees, and you'll have seen that in the slides, that those committees are those that will have something to do with the process of rolling out the vaccine. Then linked to that are also other structures. In the area of governance, we've got the DG setting up a structure which is involving both the private sector, the labor and civil society to work together in coordinating our response in terms of taking this vaccine to the different levels of of our people. That most of the current vaccines, we're storing them at Biovac, but in the rest of the country, we've identified centers where we can have the vaccine stored under the requisite cold chain conditions, so that they can be well kept for preservation. There will be obviously very good security at that level. Now, all the provinces have produced the plans and they are ready to move to start vaccinating. In the course of all of that, we have a number of health workers trained. We've also engaged a number of health stakeholders now, religious leaders, traditional leaders, civil society, and so on, to actually explain to them the role that we wish them to play in this whole process. So ours is to then make sure that we continue to get the support from the Ministerial Advisory Committee in terms of what other steps and any new information that needs to be taken into account as we move along. We must say that it's not going to be a smooth process. We must expect that there will be mistakes, there will be stop-starts issues, there will be issues of new lessons, there will be issues of challenges, obstacles. All of that will be taken in our stride as we move on. We wouldn't really, if there's a problem, start saying that, look, this plan is not working. We will actually be saying, we found a new challenge, we're going to resolve it and move on until we've actually successfully vaccinated everyone. We've seen that in some of the countries, simple issues such as the breakages of vehicles and issues of freezers, breaking down and so on, can be serious problems. And so we are aware that it will be it won't be a smooth issue. We will still maintain that the phases, we want to get the health workers out first, and that covers everyone who comes, who deals with sick people, and that is whether it's hospitals, universities, research bodies, traditional healers, clinics, and everyone. Those will be the ones we're going to focus on. We have launched the electronic vaccination data system, which will register the health workers. I don't know today, but by the time we did the launch, at the end of the day, we had gone to about 68,000 people. So it means the uptake is quite good. And so at this point, we're of the view that from the health workers' point of view, there's a huge expectation that these should be, the vaccines will have a good uptake. Then the second phase are all those who are in the front line. That goes from teachers, police, all those who are servicing communities, they should be in the front, and then of course those with comorbidities. That gives us close to about 16.5 million people. And then that phase should, the first phase should take us about 3 months, the second phase should take us about 6 months, and then the last phase should take us 3 or more months, depending on what the situation and the supply would be at that point. However, we do anticipate that if we find that we are able to secure adequate vaccine before the end of 3 months, we'll start the second phase, nevertheless, and open up our logistical processes to move on. We have indicated that we have engaged a number of platforms and manufacturers to get the vaccines, and we've indicated that the 1.5 that's come from India, the Serum Institute, that has been paid for. And then we've got agreements now which we are finalizing, waiting for the final agreements with the specific dates, delivery dates and amounts per batch and so on. That should be coming in the next week. But nevertheless, on our terms of agreement, originally we have got the 9 million that is secured from Johnson & Johnson, and another 20 million that's secured from the Pfizer. And then there's also another 12 million that we should expect from COVAX facility. And all of that together we will ensure that we will have at least no less than 26 million people's vaccines already assured. But the other vaccines, we've actually laid our hands onto where we'll get them from. We will not announce it until we've got some kind of agreement with those that are part of it. So if you look at your document, although it talks about what could be a shortfall, what in reality it means is that those are the ones where we've not put agreements in place yet. So, but it's not like that we don't have any a sense of options as to where we're going to be getting them from, and negotiations are going on at that level. Then we are also in touch with a few others. We have already have a contact with the China, Sinovac and Sinopharm. They've been very, very supportive as well. They wanted to offer as well to collaborate with us, and our scientists are working together with them. We've also worked together with we've met with the Gamaleya Institute, the Sputnik V, which has just come out as well as having very good efficacy as well, and our teams are working with all of them. So with any concrete plans going forward, we will discuss with them. With Moderna, we're also engaged with them. So literally on the main ones, we are actually engaging continuously, but where we haven't got anything signed, we will not say too much about what we're negotiating with them. And so without wasting too much of your time, I think it's important to say that, as I've said, that our system, we have a number of research laboratories, some from agriculture, some from medical researchers, who have got a capacity to store up to -70 degrees. But we've also been seeing that the number of private sector are interested in offering these services. So that work is going to be done. We will put up an open bid for those. It should have come out maybe today or tomorrow, just for the future, because this current one with BioVac managing it, we don't need much of contracts with it, but we're going to be looking at that. So in this context, therefore, we are on course, as we've indicated, that the current vaccine have gone for testing in the quality control laboratory, and then of course they'll be back in the next few days. So every province has got its own areas where it's going to be able to store, and we are actually moving. We've got a whole map, as you will see on your slides. It's showing everywhere where there will be distribution. It tells us you can go right as far down as district hospitals to clinics where there is need. And there is a lot of coordination also going on in the private sector. We're working very well with the private sector. As we said, that government, for the purposes of the national vaccination campaign, government is procuring and is also supplying both the public and the private sector side, and there's good cooperation there. There's also a lot of support from the private sector in the form of Business for South Africa, and of course yesterday we're at the NETLEC. There's a lot of support to come in with additional expertise to help government where we need support, particularly on the logistics and the administrative infrastructure. So there's an open what called work streams that are working on that particular issue. We also have got in the interministerial committee a focus on the capacity for South Africa to manufacture own vaccines, and we're moving in that particular direction. A number of countries that have indicated support to work with us in improving that capacity. And so all of that is part of the work that we are busy with at this point. So with all of that, I think that the main issue that we have to focus on is the limitation of the risks. At this point, on the procurement side, we think that the risk is much less, because it's going to be Treasury and National Health Department that are going to be procuring. They are aware, for example, that there are a number of offers for vaccines. But what we have done is that if it doesn't come from the original manufacturer, we've actually asked them to come forward and show us what they are offering, and then we will then first validate them and make sure that their authenticity is beyond question, and that the quality of the vaccine cannot be in doubt, and then we can start looking at all of that. So all of that is on course. The area where we think there may obviously be contractual issues that need to be given attention, so that we can prevent fraud and corruption, is in the area of logistics, deliveries. In that area, we will have to be very tight as we work with them. We have already met with the Auditor General, who has given us ideas in terms of which way we need to be looking at. There's also a lot of interest from some of the bodies, such as Corruption Watch, who have already started asking to follow up what's happening and getting information and so on. we're determined to make sure that the process is as transparent as can be, and that at the end of the day, we don't want to really be bogged down by problems of corruption. We want to make sure that our focus is on what lessons we get out of this process, and we have a successful vaccination campaign. So we have therefore a whole risk assessment analysis program that the Interministerial Committee is focusing on, and we've actually brought in the Fusion unit, the unit of the investigators that are involved in from the different arms of government, that they will actually work in very closely with us to come in as soon as there's suspicion or reports of any malfeasance, so that we put that one out of the way. We also have to look at the issues of theft on the ground. We believe that because the vaccines are going to be free to the recipient, and that government and medical aids are going to be paying for it, particularly the administration costs. So there shouldn't be anyone who must therefore be paying to get a vaccine. And if there is anyone who has to now start having if there's anybody who's going to be paying for vaccine, we need to really question that quite carefully as to what is happening there. But from where we sit, if there is no payment for the vaccine, then it limits the market, the black market involvement in this whole case. Those are some of the issues, and of course, your own observations would be of interest to us. We'll try and create a balanced system of procurement to make sure that there are opportunities both for people who are capable of rendering the service in this area, and that we offer opportunities for SMMEs, and as long as anyone who comes in will actually be able to meet the standards of what we are looking for, then we can deal with it. So the rest of the issues around the security of vaccine is going to be taken care of as a matter of major focus. And we also hope that the members will also give us some of their ideas of what needs to be done. Let me just say, for example, the one issue that's a very interesting debate that's going on around is a question as to at which point do we bring in all these leaders here, the members of parliament? Should they get injections first, or should we wait for the people to come in? Others, I saw a paper written by some fellows in the UK who were saying, no, everyone must wait their turn based on the vulnerability index and so on. But I think there are lots of myths and disinformation. It may well be useful to make sure that to boost confidence, some of the leaders must also move in front, just to make sure people don't feel that the leaders are also afraid of taking the vaccine themselves. And so we'll have to balance that one up. Chairperson, honorable members, let me hold it at that, and then we'll be ready to pick up the questions as we go along. Thank you very much.
Thank you, Honorable Minister. Since your last update, we have just been receiving provincial leaders to come and update us as to their readiness to take the vaccines from you. And we will on Wednesday be getting province number 6. We already have had a presentation from Western Cape, Eastern Cape, KwaZulu-Natal, Gauteng, and Limpopo. So on Wednesday, we'll be having Northern Cape. These ones that are coming in much later have a better plan, stronger than those that came much earlier. So it does indicate that this is a work in progress. I've been informed by some of your members in the department that the presentation was updated, but then I said, look, maybe those new slides will be incorporated into explanation further as we take the questions and we don't go on it one by one. The following members have indicated their interest and the desire to engage with the minister. Please, honorable members, let us also make sure we ask but make room. First one is Honorable Ismail, followed by Honorable Imam Sheikh. Number 3, Honorable Van Staden. Number 4, Honorable Wilson. 5, Honorable Chirwa. 6, Honorable Kwahobe. 7, Honorable Dr. Tembekwayo. And 8, Honorable Dr. Jacobs. Those are the ones that have forwarded so far to me, and I'm noting them. If honorable members say, oh, and then there's another one that has just come in now, number 9, Honorable Sokacha. If you can then come one after the other, giving you those numbers that I think you are keeping. Let's start with Honorable Ismail. Thank you very much.
Good afternoon, and thank you for the presentation. Good afternoon, Chair. Minister, please advise why vaccines were procured so late. We expect to experience a third variant in June or July. How are we going to reach herd immunity by that time? It is really sad to think that we could be losing so much more lives because of government delays in procuring these vaccines. What is the total amount paid for all the types of vaccines currently? And have South Africans from all walks of life been included in the vaccine trial program? Please, can you specify on what basis were vaccine suppliers chosen? What was the deciding factors? Was it prices? Was it availability? How effective are the vaccines procured against the COVID-19 variants in this country? Please, can you provide us with a full report on donors of these vaccines, if there were any donors? Minister, many South Africans are, very skeptical about these vaccines. How sure are we as a country that, these vaccines are really indeed safe for South African citizens? South Africa has ordered vaccines from the Serum Institute of India. Now, we know that this is a private company and nothing to do with the Indian government. We are essentially purchasing vaccines at double the price as compared to other African countries. Were there no other options available? I know you've stated that the government is in discussion with other countries, but I mean, at this particular time when these vaccines were procured, I mean, I'm thinking that we should have been thinking about this already last year. Why couldn't we source these vaccines from Aspen directly? And at this stage where we are with the COVID-19 variant, as where we are right now in the country, how far is our country preparing to, develop our own vaccines? Minister, now that SAPRA has agreed for the controlled use of ivermectin, where will South Africa source ivermectin from? I see you haven't touched on this on your presentation, but if you don't mind, if you could answer us. Will there be a GMP set for ivermectin? I mean, will there be a single exit price set? And will you consider setting an exit price so that we don't have an influx of pricing now that ivermectin will be, available in a controlled manner? Minister, are all vaccine sites adequately equipped for cold storage and backup generators in case of power outages and load shedding, which we know is very well known in our country? We have had some provinces coming out to tell us, but I mean, we haven't heard from all provinces as yet, so we would like to hear from you. The SMMEs that qualify, you have touched on it, but what are the requirements to qualify? Minister, please advise.
Honorable Ismail.
Yes.
Honorable Ismail, you are on question number 15, and there's other 8 members. There are 15.
Chair, are there any clinical trials on ivermectin in the country presently? And Minister, there's been some noise on social media that some vaccines are not safe for senior citizens. And there were some queries on the impact of vaccines on people living with HIV and AIDS. Please advise on how you are dealing with this. Thank you.
Honorable members, we might have a second round. Please be considerate. To get 12 questions from one member at a go is not accommodative of other members to also have to ask questions. Please let us considerate of other members. Honorable.
Thank you very much, Chairperson. Can you hear me?
Yes, sir, we can hear you.
Thank you, and Minister, thank you very much for your short presentation. Let me start off by saying, Minister, that I would have absolutely no problem as a leader in the community to be able to take this vaccine if this is going to give some level of confidence to our people on the ground. But let me start off by asking you the first question. Minister, do you not think it is important that before these matters are brought in the media, in the public domain, that the Portfolio Committee on Health, which is responsible for oversight, should be briefed so that when we get questions from the public and the media, we are able to respond accordingly? More often than not, Statements are being made, press releases are being made, but members of the portfolio committee know very little or nothing about what is happening. That's the first thing. The second thing is this. Could you tell me, Minister, how is it that your department orders these and entered into procurement contracts with various suppliers? Whilst I don't have a problem with it, because we ought to be in a hurry to secure these vaccines, there is no authorization or application by SAPRA, who said to us the other day that they are responsible to authorize these things before any orders are placed. And no authorization was provided to them when any of these things, currently even with all the vaccines that are coming, other than the one that has just arrived, there is no authorization from SAPRA, who ought to be the regulator responsible for authorizing them. Now, the other thing is this, some of the vaccines have an efficacy rate which is quite high, 95%. Could you explain what is the rationale behind purchasing from companies like Aspen or Johnson & Johnson, which has a much lower success? Could you please explain that to me? The other thing is this, that whilst you're giving us a plan, provinces are still asking the question or raising concerns about the funding that might or might not be available. Like the Western the other day, they're looking for 1.7 billion and they don't know where they're going to get this money from to be able to, in a satisfactory manner or in an effective manner, roll out these vaccines. So we're concerned about that. Now, the other thing is this, what appears to be, some kind of confidential agreement the national government has entered into with these providers. My understanding is this, that these companies that are providing these vaccines are not going to be liable should anything go wrong, because remember, this is a brand spanking new vaccine. Couple of months, we don't really know what the effects, and we hope and pray that it is really going to be effective and are not ever exceeded. Now, what is the position if should something go wrong in terms of who is going to indemnify people that are taking these vaccines? The other question is the issue of the tracking, and I see you've got a great system in place. Will that system include all those that have been taken the vaccine and over a period and I've monitored for any such side effects and things like that? The other issue in terms of that I want to deal with is the issue particularly about ivermectin. Now, I remember you saying that, Minister, and your department saying that this is a sole responsibility of SAPRA. My understanding was that National Department of Health ought to have been in the forefront of accelerating any process to review any data that's available anywhere in the world. And SAPRA says that it is the Minister of Health who was not happy about it. In the meantime, the National Department said it was SAPRA's responsibility. Now that SAPRA has given us some guidance on the processes that need to follow, Minister, it's not giving us a clear indication, because some of the experts and scientists are saying that you can use it as a preventative measure. SAPRA is saying that doctors must make an application, and I do agree that you don't need authorization, you must make the application. I think it is more to help SAPRA in checking on side effects and following it and looking at its success and whatever it is. However, how and what process will be made if people need to be able to take this particular ivermectin, because it is also their right to be able to protect, and there is no side effects, there's no doubt. For 30, 40 years, this is proven without any doubt in any case. So that they could also have that, but in a controlled environment rather than what is happening. And my other colleague had just wanted to know from you exactly which are these companies. And if we could take away the bureaucracy in terms of this, I think it will go a long way in being able to help us. The other thing is the vaccines. Is this now going to be an annual vaccine after we've exhausted giving it to everybody like we have the flu vaccine? Then lastly, the AstraZeneca vaccine that we have come, there is indication from some countries it cannot be rolled out for people that are over 60 years of age due to the risks. And I think some countries like Germany and things have now made it very clear that it will not be given to people over the age of 60. But very importantly, which we are not talking about, that some of these vaccines have proven to be fatal in some of the countries, although I think some research is being done to that effect. Like if you look in Norway, over 30 some odd people have died by taking the Pfizer vaccine, and I think it's under thorough investigation. So could you tell us, can we be convinced or satisfied, Minister, that indeed there's nothing really to worry about in the country? Take the vaccine, it's the right thing to do, so that we too can have confidence as public representatives and go out and tell our people with no doubt whatsoever that yes, this is the right thing in fact to do. Now you're talking about SMMEs, Minister, and I agree with that. My problem is this is about to be rolled out in the next day or two. When are we engaging with this process? Thank you very much.
Honorable Imam Sheikh, you said last, and then you start another question on SMME.
Yeah, it comes up, Chair, all the time. There's so many we have. 2 hours is not enough, Chairperson, to engage with the Department of Health. It's just not enough. With due respect, let us be honest.
We are guided by the availability of the minister because he has also other pressures to handle in the country. Honorable Van Staden.
Thank you, Honorable Chairperson. First of all, I want to say happy birthday to the Honorable Minister. I forgot to send him a message this week, but yet is happy birthday, Honorable Minister. Honorable Minister, will be there enough and sufficient trained healthcare workers to do the vaccinations, and can a report be provided to us of the amount of healthcare workers per province that will indeed do these vaccinations? In your presentation, you mentioned a shortfall, and you just talk about it, of vaccines of around 38 million doses. Can you just explain to us again, how is this going to impact on your plan to vaccinate the 40 million people by the end of the year? I mean, already you are running behind with the 1.5 million vaccines that South Africa already received Monday from India. With this 1.5 million doses, you can only vaccinate 750,000 people. So I think we need more clarity on that. What assurances can you give South Africans today that there will not be any corruption in the tender processes, in the distribution and administration of the vaccines? And I'm glad to hear that you say it will be an open tender process. Let's hope it will stay that way. How will government monitor citizens that is not able to register via the app due to the fact that most South Africans do not have internet access or the necessary tools to access the internet? In October 2020, only 1 million citizens accessed the COVID app out of 60 million people. I think that's a matter of concern. Is it safe to import a lot of different products of the vaccine? Is it safe for one person to probably receive 2 different shots of the vaccines? And if not, what plans do government have in place to see to it that the patient indeed receives 2 shots of vaccines that is from the same product? And then some scientists say the vaccine will be successful and others say it will not be. What are your views as the Minister of Health on this matter? How do we know, or what guarantee is there that the vaccines will indeed work? If the vaccines is not effective against the COVID virus, will you as a minister approach SAPRA to approve ivermectin for human use and to legalize it to treat COVID-19 patients outside a Section 21? And will you classify it, for example, as a Schedule 4 prescription-only medicine or a Schedule 8 as a controlled drug medicine? I have asked you last month, and I'm asking you again, Honourable Minister, will you be able to reach your target to vaccinate 40 million people by the end of the year? I'm asking this in the light of the different dates communicated by this government, the President and yourself, on when the country will receive what type of vaccines. I remember on the 7th of February, you said in this committee that 316,000 vaccines will have to be administered every day of a week to ensure that at the end of the year, a total of 40 million people will have been vaccinated. Now, that target is already missed with 29 days. Today already is the 5th of February. So will you be able to reach your target to vaccinate 40 million people by the end of this year? Can the Minister also give us a timeline? Where will the vaccination program start across the different provinces? Because of the reports we have received from provinces this far, not all of them are very good. And will it all start on the same day across the country? Or how exactly will this program be rolled out? Another question is, what precautions and security measures are being put in place to ensure that the vaccines do not get stolen? And will the transport and distribution of the vaccines across the country be safeguarded? And how will you do that? And if you can't tell it on this forum, that's understandable, but then we need a report, an urgently updated report on that matter. Now, 34,000 healthcare workers have already registered to receive a vaccine. I want to know how many healthcare workers must still register for phase 1, and how will you help healthcare workers to register if they do not have the time to do this process or do not have the access to do this process electronically? When exactly will you start with phase 1, 2, and 3 of the rollout plans? Can exact dates and timelines be given in an updated report? What exactly is the government plans with the COVID-19 vaccinations? I think that's a question which is on everybody's mind at the moment. And the government have demonstrated time and again that it's too incompetent and corrupt to be trusted with the management of a project of this magnitude, and thus provinces like the Western Cape, as well as private institutions, must be involved in the administration of a countrywide vaccine program so that the people who want to get the vaccine do not have to wait for it. Isn't it so? But this government lack of faith in the province's abilities is a damning admission by the ANC and this government, but that the provinces under its rule are incompetent in this matter. And lastly, Honourable Minister, why will you and the government not allow the Western Cape Provincial government to import the vaccines at once so that people can exercise the right to be vaccinated if they wish to do so? Thank you, Chair. I will pause here and I will raise my other questions in round 2.
Point of order, Chair.
Okay. Point of order, Honourable Jacobs.
Thank you very much, Chair. I think it's only correct that one should take huge exception to what Honourable van Staden just mentioned in terms of provinces and also the departments in terms of corruption and the ability to perform their functions, and that all of it seem to be, according to what he is saying, would be subject to corrupt practices. I think it's not correct on such a public platform for Honourable van Staden to say what he had said. And then on the other hand, also we find that members say things as long as they get it out there and then apologize for it afterwards. We need to really look at what is correct and what does give us a meaningful contribution to the dialogues and the discussions. Thank you, Chair.
Proper Chairperson, with all due respect, I'm just asking a merely question which is on the minds of the public out there, and the corruption which happened last year was widely reported in the media. It is good that the public must know the answer to this sort of question. I can't see anything wrong with it.
Yeah, honourable members, I do note 2 members so far that have asked way above 12 questions. That is Honourable van Staden and Honourable Ismail. I'm not limiting any other person, but if there's going to be any second round, those members will come at the bottom. They won't come at the top list, as they have actually taken more than 12 questions. Not that you shouldn't have asked all, but all I'm saying is just to share with other members. Honourable Wilson, you are next to ask.
Thank you very much, Chairperson, and a belated happy birthday to the Minister. I hope you had a really blessed and awesome day under these trying circumstances. Minister, I've got a few things to raise. First of all, and perhaps you can correct me, understanding of a vaccine. It's something that we give people, number one, to stop them getting a virus, and if they do, in very, very mild circumstances, transmission of those viruses. And I think this is quite an important thing to raise because these things are going to be quite important. And hopefully, if that is the case, we will stop wearing masks sooner than later because it will be safe to do so. Minister, in your presentation, we have 1 shipment of AstraZeneca, the first 1 million doses which have arrived now, with 500,000 to follow. On the presentation from SECRA, we are notified that these were at $4 a dose. Is that in fact correct? And did we pay $4 a dose from AstraZeneca, or were there other things involved in this purchase? I see there is only 1 shipment from AstraZeneca, and I must question why. First of all, we have news today that Belgium, Switzerland, and Norway have banned the use of AstraZeneca. For a myriad of reasons, and I always get very uncomfortable when we've ordered AstraZeneca and that kind of news breaks out, you did say we can't get or give people anything if there is any doubt. And obviously in those 3 countries, there has been a lot of doubt. So I'm concerned about AstraZeneca. And why we only are getting 1 shipment from AstraZeneca, and particularly when it is the cheapest of the vaccines. According to your report, Minister, on the procurement of things between now and April, according to your report, and taking that the shipment that we get must be divided into 2 because everybody will require 2 doses of the vaccines on your list. Between now and April, we will only be vaccinating 1.59 million people. From May to August, when we go into the winter months, where we are expecting the 3rd wave and where the people are the most vulnerable, according to your presentation, only 5.76 people will be vaccinated. And from there to the end of the year, a further 7.35. And in fact, if I look at your whole presentation and I take what we are getting, we will in actual fact by January, according to your presentation, only have vaccinated 36.2 million people, which is way below the requirement of this country for herd immunity. It is also 10, 11 months away. Now, we are sitting in a crisis. People are, there's another wave coming, winter is coming. I'm sorry, I do not believe or cannot accept that it is acceptable to only be doing these amount of vaccinations every month. We are going to run into a problem. And on that same presentation, Minister, and I see the bulk of the vaccines are coming from the Pfizer group, who's at a cost, the highest cost of the vaccines at $20 a vaccine, which also turns alarm bells to me. I certainly hope we're not going to find that there's anything behind those procurements. But I question why the bulk is coming from the most expensive provider of vaccines at the moment. There's a lot of purchasing done by COVAX. Do we have any indication of what vaccines we're actually getting from COVAX? Because I gather it's an organization and not a company. And Minister, concerned, we have had presentations by the provinces, and we only have 2 to go. Now, understandably, some of those provinces did present to us a couple of weeks ago, and Gauteng just day before yesterday. But the indications are, Minister, these provinces are nowhere near ready whatsoever to deal with vaccinations, the distribution, the storage. Gauteng told us on Wednesday that they haven't even got the IT equipment ordered, let alone delivered and installed to manage the data processes that are very critical to this process. And that's very alarming. I mean, you cannot start vaccinating until such time as all your processes are in place, and they're not even close. And the longer this takes, the more people are going to die and the more vulnerable we become, and it's not acceptable. I am concerned about the tender processes, and I raised the issue with SAPRA to inquire if they had been involved in the tender process, because the storage and distribution of these vaccines requires very specialized management, and I have a concern on that is going to be properly managed, and particularly also the medical waste disposal, following reports of China that people had stolen vials from waste disposal sites and were filling them with saline water and selling them to desperate people as a vaccine. Minister, and a request, and I think it was raised by the Honourable Van Staden, we get a report every day on COVID results, how many tests were done, how many positive, what the recovery rates have been, how many deaths, etc., etc. And I would like to request, Minister, please, that we start getting that report on, like we get the COVID report, that we get a daily vaccination report. How many have been done in each province, how many have received first dose, when those people have received the second dose, and on a daily basis, how many people have been vaccinated. Very, very critical information, and I would really like it if we could be sitting on that. Malfeasance over procurement, always a big issue. Malfeasance can be, of course, the word can be changed for something that is very prominent in this country, and it's simply called corruption. We must make sure that that's stopped. And Minister, I have been present on the last couple of webinars that you have held. I'm always very concerned that these webinars are held and these presentations are done before the Portfolio Committee has even seen them or been advised of them. Those documents and reports are very, very important to us, because what happens after those webinars, ministers, that people phone us and say the minister said this or the minister said that, and what does it mean, or is this correct? And when it hasn't been presented to us first, it makes our lives very difficult to answer those questions. I will leave it there, Chair. I would like a second round of questions. My thanks.
Okay.
Thank you, Chairperson.
Honorable Chira, you're next. Yes.
Yes, thank you, Chairperson. My video will be off because of my connection issue that is still persisting. First of all, Minister, thank you for the briefing in the beginning part of this meeting, and a belated happy birthday to you. You officially reached pension age, and we congratulate you on that milestone. Firstly, Minister, I'm particularly worried, and I even raised this with the Gauteng Department yesterday or 2 days ago. The issue of the fact that there isn't enough science to support the rollout strategy that is being done, especially for phase 2 and phase 3, in the sense that it is not cognizant of our social make and our social makeup as a country. For instance, somebody would be noted as a vulnerable group in their 60s, but uses their own transport, is not in the same risk category as somebody who still works, who uses public transport and of that very same age, of that very same race, and even at the same community. So I think there should be much more effort in creating a science and how this rollout strategy will be done, cognizant of culture, cognizant of geography, cognizant of social implications and social effects, and how people have interpersonal relationships. A strategy for rollout in informal settlements cannot be the same as a strategy rollout for people living in suburbs. And that is the reality of our country, unfortunately, to date. And I think there isn't enough to base our rollout strategy on our reality as South Africa. And secondly, it's becoming a persisting problem or issue that there isn't enough information that is being mainstreamed to communities and even members of parliament, quite frankly. For instance, people do not know that the SARS vaccine production doesn't start last year in 2020, but that it has been the case. It was shelved many years ago and is only taken off from the shelves to continue the process that was started many years ago. So even the issue surrounding safety and all of that for vaccinations is because people don't have enough information at their disposal. And I think that also falls back to the lapse of the NTOH, because it's primary to your obligation and mandate as the National Department of Health. It's primary healthcare, prevention, and education. And those are the 3 tenets of our health system that are not being prioritized, sadly, especially because the process of vaccination is about facilitating prevention and primary healthcare. The education around that is not done extensively. And that should be looked into, really, because it keeps on persisting that people don't have enough information on the issue of vaccination. Even the safety concerns arise from the fact that people don't have enough information. And number 3, with the issue of patenting, I feel or think that government has not problematized this practice on a global scale enough, especially if as according to the minister's assertions, that there's intentions and efforts to ensure that we make our own vaccination in South Africa. What then becomes the position of the South African government around the issue of patenting? And to this effect, please then also give us dates on when will this be an actual program of the NDOH to facilitate the process of creating our own vaccination, the team behind that, or if at very least, if it's just an idea, please also make it clear that it's just an idea for now and there aren't any resources that are put to that effect, or there aren't any efforts that are directly facilitating that process. Like, for instance, if you are saying there's going to be a vaccination or that there's going to be an intention to make our own vaccination, I think it would only be fair to also outline when this process will unfold and how it affects even the procurement system that is currently taking place in the country in relation to securing vaccinations from other countries. And number 4, with the issue of BioVac, Minister, this partnership between BioVac and government has been happening since 2003. There's been almost 2 decades of the government having a partnership with a pharmaceutical company and thus neglecting their own pharmaceutical company, especially because last year in June, you, Minister Zweli Mkhize, said that you guys will put more efforts in ensuring that Nkitlapela finds stability or is able to function. And the past few months were an opportunity for the department to do that, but that was not done. If anything, this highlights the fact that we are more and more leaning towards taking our obligation to service people with healthcare and primary healthcare to the private sector. This is also widely spoken with the issue of the tenderpreneuring system that keeps on persisting despite the irregularities that come up with it, despite the corruption and all of that. We're not ensuring enough that state capacity is being built through this process. We've had months on end knowing that the second phase or the second wave of the virus is coming, the third wave, the fourth. You've even warned that the third wave might be even more catastrophic. But there aren't actual programs to ensure that the public healthcare system is able to facilitate health programs on its own without relying on the private sector. And for instance, even the issue of security, SAMA had raised years ago that there must be a biometric system adopted by clinics and hospitals to particularly protect medication and clinics. And this is not done even to date, right? So it means that even though you are responsive to some of the recommendations, the ones that really matter in regards to capacitating state capacity are not being implemented. That is my primary concern. I think if the minister can just look into those things as well, instead of just really putting the burden of taking care of public healthcare on private sector, because that is the direction we're going, especially with the introduction of the NHI. It's just more and more of the government relying on the private healthcare sector to take care of the burden of what should be taken care of primarily by the public healthcare sector. So yes, those are my first contributions for this round of questions. Thank you, Chairperson.
Thank you, Honorable Shirwa. Next is Honorable Kwahube.
Thank you very much, Chairperson. I have a number of questions, but I think mine are more thematic than sort of listed. Minister, I think there needs to be, I think we are perhaps misunderstanding what the expectation is from members of parliament versus what government seems to wanting to be doing. The reality, Minister, here is that PowerPoint presentations are great and they're informative and the webinars are wonderful and you are able to onboard the country. But this still does not in any way replace the need for a tabled, codified plan of the entire vaccination rollout strategy. And I say this because it's an important distinction to make, Minister. And I get what you are saying about the difficulty and the fluidity of the situation. However, it still does not replace the need and actually the obligation on you and the team and the South African government at large to produce a comprehensive, coherent plan, which shows us the following, Minister. It will show us concrete timelines, even if those are moving targets. How much government is intending on paying per vaccine, from which manufacturers, those that have been confirmed, what the procurement processes are, instead of drip feeding this information and saying we're unable to provide this information for this and for this reason. The reason why this is important is because as members of parliament, we need to hold you to account to something that we can hold on to that says this is what the South African government committed to and this is what needs to happen by this date. And if it's not happening, then we call you here and ask you why. But if we constantly have to be drip fed information and we have to, scramble for info. We see media reporting that this is how much we're paying for a vaccine here. This is how much we're paying for a vaccine from this manufacturer. It fuels a chasm between the two spheres of government, which is the legislature and the executive, but also it fuels a lot of disinformation. So I do plead with you to perhaps address this, that this is something that is deeply needed, that you can provide. And I think it's not something that is impossible to ask, even with the fluidity of the situation, and even though things are changing on a daily basis, it's still required. And the presentations and the webinars and the information sessions don't replace the need and the obligation on that. Then on the presentation, Minister, I would like to ask the following questions. I see in your, perhaps this is more of a matter of clarity, I see in your presentation in the timelines that you've provided that the AstraZeneca vaccine, the second tranche of it, is now only expected to arrive in March. You'll remember several weeks ago when you made the announcement, it was a matter of the first million arriving at the end of January, which arrived on the 1st of February, which is technically, within your timelines. But I see now more concerningly that we are looking at March as for the second tranche. Now, a number of provinces that we have asked whether or not they're going to be vaccinating people with their first dose and waiting for the procurement or the acquisition of the second dose. And a lot of provinces have said that. So I'm wondering now, with that moving target, how does that take into consideration the fact that now, will we be able to meet the deadline of a second dose for every single healthcare workers that's received the first dose? Because if we are pushing out the timelines, will we make the time that's needed for the booster dose? And then, Minister, I also see in your presentation that the Pfizer vaccine, which we obviously know has very different requirements from the vaccine that we have now, which has far more stringent and stricter and far more sophisticated requirements for storage. And it's due to be arriving in February, which is this month. Now, from our interactions with the provinces, a lot of them are at different places in terms of readiness. So are we confident that the consignment that is arriving from Pfizer will be able to be accommodated for the cold storage requirement that it has? And linked to that, Minister, I think perhaps the first phase of the rollout is going to be slightly more manageable, but I think we're going to start to see a lot more problems when we look at the second phase and the third phase, when we start to delineate far more to the primary healthcare facilities. Again, we met with Gauteng earlier this week, and I mean, they were very honest about the fact that the primary healthcare facilities are nowhere near being able to roll out vaccinations to the general public, just because of inadequate IT infrastructure, inadequate cold storage infrastructure. I mean, these are things that need to be fixed as in yesterday. And so, is there a plan in place? Because I think perhaps in your next update, you need to at least be updating us on how these are being mitigated. I know you've got a section here on risk mitigation, but I think it's quite important for you to be able to highlight this is where we're weakest and this is what we're doing to fix it. And lastly, Minister, I see that, I mean, you have been very adamant about the fact that government is not in any way behind with the scheduling of attaining vaccines. But a letter which was written by Treasury a couple of weeks ago indicated that your department only applied for a deviation of procuring a vaccine on the 6th of January. Now, I just want to understand, I mean, why that delay? Why was there that delay? And surely this is a process that should have been started last year, simply because, as many members have raised here, we've got an audacious task of vaccinating 40 million South Africans, and which we must meet. But are we going to be able to meet that target if it seems as though government is rather sluggish in the starting and the acquisition of the vaccine? Thank you very much.
Okay, next one, Honorable Dr. Tembegwayo.
Thank you, Chairperson. I just would like to say to the Minister, there was a humble request from the EFF Chief Whip specifically to ask the Minister to be accompanied by the Minister of Finance and/or Treasury to our meeting. Well, during the last meeting, you gave an apology that was acceptable to all of us. To my amazement, the request hasn't been honored. So I just would like to know why. Because there's a lot of costing matters that needs to be addressed specifically by the Minister of Finance and or the Treasury. The following question is, what is the estimated cost for each phase, not only the first one, the first phase, of the entire vaccination program, as well as the entire project? And how will this be funded? Where will the funding comes from? If the Minister of Finance was here and or the Treasury were here, they would help you to approach or answer this question effectively. The next question, what are the safety guaranteed measures of the vaccines for the healthcare workers living with HIV and AIDS and other comorbidities? Meaning, what measures are in place to detect any side effects or lack of efficacy of the vaccines? Security measures, Minister, plays an important role and has to be addressed with caution. What extra measures are in place to prevent fraudulent vaccines entering the country or leaving our country? Because that has to be in place. The next question, almost the last one. Yeah, but not the last one. And I'm still repeating what my colleagues have said, to say we have had representations from different provinces. Yes, we agree with you that you are ready as a minister to roll out these vaccines, but your provinces are not ready. From their reports, obviously, it's obvious that they don't have a proper rollout plan. There isn't a distinct communication, a channel that is used to reach out to those that are supposed to receive the vaccines from phase 1 to whatever the last phase would be. So sometimes we would call upon the representatives of the provinces, because I believe you have a committee that oversees the provinces, to come and talk to us on this, because we receive different, programs that run parallel, as if they are not representing the provinces within one country, which is South Africa. And lastly, there are reports that South Africa is paying more for vaccines than other African countries, as well as the European countries. If these reports are true, of course, Minister, why is this the case? And how will the country procure vaccines cheaper in the future? Thank you, Chairperson.
Before I forget, Honorable Dr. Tembekwayo, I received a letter from the Deputy President of the EFF, the Chief Whip of the party, requesting that on the meeting that we are going to have, can the Minister of Health be joined in by the Minister of Finance?
I'm sorry, Chairperson. I think you can do that later after the Minister has responded. Please, thank you.
I was the one who was going to invite the Minister of Finance, because we needed time with him alone as a portfolio committee. I wanted just to say that. Honorable Dr. Jacobs.
Thank you, Chairperson, and let me thank the Minister and the department for the sterling work they're doing. Of course, we are reminded of the presentation that was forwarded to us already. And so many of the questions I think are raised, and I must say there are many questions raised by the members. I am certain that many of those answers we actually locate within the presentation. But what it also does, at least it gives clarity to the members when the Minister answers those questions, and it allows us and the public at large to get answers to many questions which are out there. So therefore, let me speak to the application of the measures implemented by the Ministry and the NDOH. We understand that this is a momentous task. It's a very big task, and therefore it's an ongoing work. And as we understand, there will be changes and updates to the presentations. And it's correct that the minister does have his webinars and does have those shows on television, etc., so that the public can also be informed, and not only us as members of parliament informed as to where things are going. The presentation speaks to many of the variables which are concerns not only of the members, and as I said, also I guess of the public. And it does speak to the procurement, and we've had many discussions on the procurement of the vaccine, which companies will be providing the vaccines, at what prices it will be provided. And fortunately, it also speaks to the distribution, how it will be distributed, that it is a nationally managed program, and that this program uses BioVac as the central storage facility. And I guess that is the way that it will be done throughout, as all the other vaccines are then procured, so that there is a control over this vaccine. And the questions which are asked and the points which I will raise will speak to the challenges, and it's good to see that it's been reflected upon by the NDOH. For example, the storage of the vaccines at the correct temperatures. We're having vaccines from different suppliers, and we know that the vaccines are stored at different temperatures as per the prescript of the supplier. And then also addressing the security measures, the tracking of the actual vaccines. This is a huge task. This is a national task, and I'm happy to see that there are thoughts going into these things as to mitigate all of the challenges. And then data management. It's very important to ensure actual vaccination of the percentage of targeted people, so that we can acquire the herd immunity, and that there is no waste within the department, or waste with the vaccines themselves. And then also theft and private sales. So it will also manage this challenge that everybody is worried about, of theft of the vaccines. We've already seen a poster out on social media where somebody was advertising the sale of the vaccine at 150 Rand per vaccine. So we are aware that there will be many who would want to target the vaccines for personal gain and selfish gains and greed. Other challenge, of course, would be falsification of the vaccine. And where is the process with regards to barcoding and ensuring that the vaccine is what it says it is, and through it being tracked through the barcodes, and the proper management of the dispatched vaccines. I want to reiterate the question by one of the members on the plans for disposal of the waste, especially the used vials, as we've now heard Honorable Wilson speak about vials being filled with saline and then being given to unsuspecting members of the public. And lastly, we should continue to warn the public, even as we speak about vaccine, that we are still within the second wave of the pandemic, that we should still have an awareness that the infection is here, that we do not concentrate all our efforts on the vaccine, and that we still send the messages we need to be spreaded, that we are keenly aware, the minister raised it this morning, that we'll be facing or could be facing a third wave of the pandemic. And as we are approaching winter, let us be mindful not only to concentrate on certain aspects, but to make certain that we address the entire pandemic in all of its fullness. Thank you, Chair.
Okay. There are two other hands. Honorable Sokacha will be followed by Honorable Gela. Those are the last two.
Thank you very much, Honorable Chairperson. Let me also thank the Minister for the presentation, and also congratulate him and his team for the good work that they are doing. Chairperson, the disadvantage of being last is always that you'll find a situation where some of your questions has already been asked by members. I've just got 2 questions, Chair. The first one, I think the Minister have touched on it, the issue of where do we stand, in fact, where do public representatives stand in terms of the queue on the vaccination program. And I fully agree with the Minister when he said we need to strike a balance where some of the public reps might be pushed forward so that our people might see that there's not a problem where we want to push them first and so on. I fully agree with the Minister. The second one, it has already been touched by one of the members when the members ask about our own vaccine as a country. So I wanted to check, where do we stand in terms of our research capacity as a country in terms of coming up with our own vaccine? Those are the 2 questions, Chair. Thank you very much.
Honorable Keller.
Thank you very much, Chairperson. Let me first say happy birthday to our Minister, Dr. Zweli Mkhize, and also to appreciate the briefing for us as a portfolio committee on the issues that are currently happening, and also to congratulate the Minister for the good work that he's doing. We are happy because we saw that the arrival of the vaccine in our country, which is a good thing and also a historically moment for us, because all of us, we are worried about this pandemic. But also, Minister, we are happy that even we have launched the communication where we can get the vaccine. People are registering currently on the database, which is something that is good, and it's been responding immediately. Where are you going to be getting your vaccine? I think so far as government led by you, you are doing very well, Minister. Besides the challenges that we are still faced, and I don't have any doubt that it's going to be resolved or addressed, all challenges that we are facing as a Department of Health. And also the national is going to make sure that it put close eyes to the provinces, especially where there's a challenges in terms of a rollout, Chairperson. But my question, Chair, it's around, I know that we have started to get the first batch of vaccine, and even other countries are also looking for the vaccine. I just want to check, Minister, because I know it's a race for the vaccine, the whole world. But I just want to check with you, how is the South Africa dealing with this competition for vaccine? And then the other one is the issue of children. We know that also there are children in the country who have comorbidities. But also I just want to check, Minister, also children are also included in this vaccine or not, at which age, Minister, so that at least we know actually. But I believe that everybody's covered, and according to the phases, people will be getting a vaccine throughout the country. And I know that if you set a target, we'll achieve our target as a country to ensure that we save the life of people of South Africa. But I'm saying well done with the good work. And you also brief the South African through the media platform. There's nothing that you are hiding, Minister of Health. Everything is transparent and everybody knows actually where are we as a country in terms of vaccine. and also the Johnson Johnson. It's in our country, and I know that there are engagements that are happening, and definitely sure that they will be also prioritized to get vaccine. But so far, I think we are very happy, and I'm saying, Minister, keep it up, the good work that you are doing and the commitment, and also the love that you have shown us as people of South Africa, that you are on forefront to make sure that at least we get the vaccine and you save the people of South Africa. I'm saying well done, Minister. You are doing very well in the department. And I'm happy because this is not the first time that you are briefing us. You always come to the portfolio and brief us where we are standing and where are the engagements so far. So what you are doing in the department, it's very good, and I believe that you are still going to keep on briefing us in terms of making sure that we have information as portfolio members, and we are able also to respond to the community if there's any challenges. And your office, it's open for us. And I'm happy because you always respond. Even if you get a message, you respond back to us as portfolio members, as we sometimes text you individually to give us what we are looking for, to make sure that at least we give the correct information to the people who ask questions to us as portfolio members. I'm saying well done to you and your team, and keep it up with the good work that you are doing. Thank you very much, Minister.
Thank you, Honorable Keller. In the interest of time, I will not ask questions. I will take it back to the Minister and his team to then respond to the questions raised by honorable members. Thanks, Minister.
Thank you very much, Honorable Chairperson and the honorable members, for the questions and the comments. Let me start by saying that, and once again, thank you for all the lovely good wishes from all the members. Maybe we should ask the Portfolio Committee to do a resolution that that the birthdays must be celebrated throughout the year. So every time I come here, I get all of these lovely messages. Then we can always all enjoy it for the whole year. But thank you. On a more serious note, I think there are a number of issues which I think you raise as suggestions that I think would be quite helpful to look at. Some of them are elements that we're going to have to look at and see how to strengthen our process, so that some of the issues, as you are asking, you might have an answer today that will be different tomorrow. But one thing I want to make very clear to the members here: we don't expect this plan to be smooth in its implementation. There will always be areas where whatever targets we set, we have to revise them, because the flow of this whole program, vaccination program, is going to depend on mainly two aspects. One aspect is the delivery, timeous delivery of the vaccines. The second one is going to be the logistical issues that you have raised around what the provinces are saying. Those are within our hands, so we'll have to go around fixing them. And so we need to just indicate that there will be challenges everywhere we go. It's a new program, it's a huge program. So to think that everything is going to be smooth according to the letter of the plan, I think would be misleading you to say that there will be no problems in this thing. So we'll set certain targets, but we do expect that there might be situations where things will have to change. So if you look at the comments from the members, let me start by those who have appreciated the receipt of the vaccines, and want to say thank you for all the support. The question of how we're dealing with the issue of competition is very, very difficult to deal with this, because whatever issues you raise to the manufacturing companies, you've got a limit. At a certain point, you've got to sign a contract. When you have not signed the contract, you may not be certain that you stay on that queue. And therefore, you might find that what was initially thought would be the delivery schedule, it would be changed by the fact that by that time, there would have been other commitment to other buyers, as it were. So that's part of what we have to deal with. Then the issues that have been raised by the Honorable Sokacha about keeping a balance, I think that's a debate that we all must engage in. And the process of creating our own vaccination capability is going to be a long process. But what we are eyeing already, we have got Aspen, which is a South African company. Then there's BioVac, which has got it's a partnership with government. That for us becomes the one area where we need to be strengthening our capacity to do vaccines. We have the interministerial committee that's going to be looking at what other initiatives do we need to go into. South Africa has in the past been able to manufacture vaccines, not necessarily all for humans, some for animals. But at the end of the day, we believe that the expertise in the country does exist for vaccines to vaccine development and manufacturing to be built on. So we believe that it's very, very important for us to focus on the building of that capacity. Right, this morning we're discussing with offers from different countries that are actually looking at this matter. And therefore, in the interministerial committee, Minister Nzimande is actually leading the stream that's focusing on the manufacturing of the vaccine. That capacity is something that over a period is going to be built over a period. And I'm sure that when something concrete is available, we'll be able to talk about that. Dr. Anban Pillay will cover some of the issues in relation to barcoding and so some of those safety issues will come in after me. But then the other question that's been raised around the data management. At this point, we have actually had quite a number of people that have registered in this thing. From at this point, we've got about 160,000 people who have already registered within the system. I think it's coming on well, and this is obviously also part of a trial run. So we have a sense of the numbers of health workers who are getting onto the system. But those who are not able to will obviously be accounted for on the basis that institutions are going to have to collect together people who are either not on PESAL or those who are on contract work, that they must also be included. So we will be able to cover those who can't themselves get access through lack of internet facilities and connectivity. So that issue raised by the Honorable Jacobs and other members, we will deal with it in that way. Then the question of South Africa paying more than other countries has also been asked by several, maybe two members. There are a number of circumstances that we find ourselves in. Many of the manufacturing companies look at countries on the basis of whether they are low income, high income, and middle income countries, and therefore they determine what price they will charge at that level. So you will notice that that's the one issue. The second issue is that there are some countries that got involved early to invest in the manufacturing of vaccines early enough, and therefore that was actually meaning that even when they had to purchase the vaccines, they would probably pay in addition to their investment to vaccine development and other research and so on. So that is what happens in the US, in America, in the Europe, and so on. That's what determines what those prices ultimately become. Obviously, in some of the areas, the bargaining on the economies of scale becomes another factor there. So those are the issues that come into this particular question of determination of the prices. Then there are countries which in the global health situation normally fund their own vaccines. Now, like South Africa, but the rest of the countries in the continent, except for 7, don't finance their own vaccines because of that. So as we're dealing with the COVAX facility, then it is therefore not possible to go and ask for, or let's put it this way, the other countries like in the COVAX facility, they depend on the donor agencies to be able to finance the amounts, and therefore the negotiation on the prices happens on that basis, which in a way does exclude some of the countries on the basis of the fact that they have to fund it for themselves, and that's what difference it makes. So in the African Union platform, if we purchase through the AU platform, you may then be able to take advantage of a pricing structure that is available to the AU platform. But you see, when we sit here and we get your questions and the comment and the criticism, some are saying, why didn't you go bilaterally and buy? If you do so, you're going to pay a higher price. We're prepared to do that where we've got that situation. And then if you wait for the AU platform, you have to actually not commit on anything until you've got something that is concrete on the AU platform. So in our case, we're actually using all the platforms. Where we can do bilateral arrangement, we will go for it. But if you look at what we paid from Serum Institute for AstraZeneca vaccine, it's the same price that was paid by Brazil because of the issue of the size of the economy and the fact that we have not been involved in the alien investments into the vaccine development. So that is how we ended up paying that amount as such. But in some of the countries, the prices are varying because of the prior investment. So that is what the nature of this situation. You have to go out bargaining. If you went in some instances, as I said here, you will find that for some reason, some of the agents will come in and offer you a price which is much higher. In the case of Pfizer, the arguments we were able to make and agree with them was that they have actually been also doing work inside South Africa, on which basis, therefore, they have to understand that South Africa has made some contribution or another in the process, some in the different researches and so on. And on that basis, then we're able to get the price to come down. It's not everybody who will be paying the $10 that we were able to earn, but of course, it depends which platform you are actually coming from. That is the nature of this arrangement. Partly that's why, when you discuss with, you've got to keep some of the discussion confidential up until we conclude the processes. Then I have addressed the question raised by Dr. Tenjigwai about the provinces not ready. We will meet with them and just check what are the gaps and so on. But we must expect that with the details that we all need, there'll come a point where some are not ready and so on. We just need to go back to them, help them until they are ready. So we are not going to be surprised if they're not ready. But when we find that out, we'll actually work with them to strengthen their capacity to deal with this issue. There is a process of what we call a detection of adverse effects following immunization. That's part of what our monitoring becomes. So we actually have a monitoring mechanism for that. Therefore, all the people who have gone through vaccine would have to be able to report if there's any untoward program. This basically helps us to deal with anything untoward that arises out of the vaccination. Well, the question of the Minister of Health has been dealt with, because obviously we have to, we don't necessarily have to be the ones who do the invitation, and so I'm glad that the chairperson is going to attend to that particular issue. Then Honorable Kwahube raised an issue around the nature of the reports. Well, I'll take your point, and therefore we'll have to sit down and just discuss what's the best way that the portfolio committee would like to see. We'll see how we can address that particular issue. But I don't think we should say it's drip-fed, actually, because we come also on the basis of invitation. We also come to the media also on the basis of questions that get to be asked, as it were. There are members of the media who will ask us questions on issues that we're still planning. Now, we cannot say that we haven't planned on that, we're going to have to answer as truthfully and as transparently as we can. But we get the same issue because if there are issues that we want to deal with in any way, because it's still under management, it's still confidential, but all the portfolio committee meetings are open. So there isn't anything that you can actually say there's anything that is hidden for the portfolio committee or is hidden for the media. We have to respond as each and every time. But sometimes the demand for information does not wait for whether we have already spoken to the portfolio committee or not. And so if there's a way of closing that gap, I'm sure we should be able to deal with that. Now, the questions around timelines and the use of some of the dosages, we have said that there are more doses that are expected, but we couldn't announce them because they had not been, some of them have not been finalized. So the approach we had taken on the AstraZeneca approach was that we'll give to everyone the first doses, and therefore we will be able to get additional doses in time to be able to give the second dose. As a matter of interest, what we found talking to some of the experts from the UK, they were indicating that whilst we say you give the first dose and within 21 to 28 days you give the second dose, in fact, there's been also research showing that you can do it after 42 days, which is 6 weeks. In fact, in their case, they've actually stretched it to 3 months, which means it's still safe to give the second dose in 3 months. The only thing that you need to make sure of is that someone gets a boost from the same dose and not from a different dose. Doesn't mean that you can't do it with a different dose, but it has to be done under some scientific research and so on. So we won't go into that. At the moment, our approach is that we deal with the first dose and the second dose, but there will be time to be able to recover, to get the additional doses to be able to give through to the rest of the health workers who could have gotten the first dose. So we're not quite worried that Pfizer vaccines will be impossible to manage. We have listened to their presentations. We think that there is capacity to get freezers at -70 degrees in the country. They have also indicated that they will be using a Kanban system, which basically means that they will deliver by air as much as is available that week, and then another bit in another week, and so on. Which means in that process there will not be necessarily overloading of our facilities, but the training that they will also be participating in ensuring that those who will be handling it are quite familiar with the strict requirements for their cold chain management. All of that is going to be taken into account. So we therefore believe that all we need to do is to build our capacity as we go along. We had given to this committee what would it mean to actually vaccinate 40 million people. And we've given the numbers and we've said this is how many people would need to be done, and this is how many people that we would need to get. But of course, you might find that as we have to build up, those numbers are not immediately available per day on the first few days, but also with the limitation in the supply of vaccines, which that might also affect it. Now, you must realize as well that we're not the only ones. Now, at least we in South Africa, we are buying and negotiating and getting the stuff. The countries that have already bought and secured and paid for the vaccine that were part of the development are complaining about how the delays are happening. They've even gone to a point of saying, don't export before you deliver to our own countries as such. So it does indicate that we will not do an impossible task of getting more than what is possible to get out of a manufacturing platform. So if we have that understanding, then I think we should then understand that we'll have to build in flexibility that allows that if there is any delay, we see how to catch up with the numbers that would have been left unvaccinated for that particular period, and try and cover as much as we could. We're approaching this thing not from a suspicious point of view of saying, you guys are, this government is not being trusted and so on. Actually, it's not even true that the government is not trusted. If you want to know how the government gets trusted, you actually look at how the voter population performs, and therefore that's how you deal with it. But when there are wrong things that have happened in any government, that needs to be dealt with and corrected so that people's trust must not be, reduced as a result of, a bad conduct. So from where we sit, we must say that we need support and cooperation as we deal with a very unpredictable situation wherein the supplies of medicine are an issue, and of course the logistics can be a problem. These challenges of logistics are actually affecting, well-organized health systems, and so we must accept that we must do our very best in this thing. Yes, of course, you have to hold government accountable, and from that point of view, we believe that your role as parliamentarians is to keep asking the questions. Some of the questions don't have the answers. Some of the questions will actually require that we, come back and say this has changed. That was the answer, but now the situation is different. Honorable Chirwa, a number of the points that you have raised, and I think for a change, are more of suggestions than the kind of approach that you have taken in the past. And I must say so, taking advantage of the pensionable age that you have wished me well on, that it is important to raise the issue of the phases, and also the fact that there are a number of issues that are involved in the question of behavioral change and acceptance of the vaccine, access to the vaccines, and flow of information, cultural issues, concerns, fears, and so on, rural versus urban, the availability of electricity, and the availability of facilities, and all of that. All of those issues are very, very important to raise. And I want to just say, we are considering those, but I think you have made a point that's worth a discussion. Then the need for more information, well, we understand that. Then the question of the patency, that issue is being handled at the WTO level, South Africa and India fighting on the issue of relaxation of some of the patent requirements. So that is a general issue that we're dealing with. But that will not actually affect the fact that when we want to create a capacity inside South Africa, we want to deal with all of those issues. It's just that as South Africans, we need to focus on the fact that if we're saying that government has to put additional resources, it needs to be accepted that government has to do so. And in some cases, a government has to play a role, and in a number of cases, of course, private sector has to play a role, and we must look at partnerships across, we must also look at empowering policies that will help us to deal with the framework that allows us to increase vaccine manufacturing and pharmaceutical manufacturing in the country. From where I sit, we need to actually do a lot more, because South Africa offers an opportunity for a huge pharmaceutical manufacturing hub where we actually work together with the rest of the continent to build these capabilities. So it's something that I think, in terms of those views, they are worth the consideration, and we are working at all of that. The Honorable Wilson raised the question around the cost of AstraZeneca, and of course, included in it are some of the cost of transport and so on, but I've already dealt with that particular issue. And then the question is, sometimes we get the question, why did you do one shipment when this drug is so cheap? The other time is, why did you buy it when it's so expensive? So I'm not sure, what actually is expected of us. But the reason why we're buying in the way we're buying is because of availability. If we, and I said this last time, if we go to a company and say, you have your vaccine, how quickly can you make it available? And they say, this is the time frame. We then go on it on the basis that we can get some vaccines a bit early. There is no need to worry about vaccines in December 2021, because by then there would have been so much of vaccines manufactured that there'll be excesses in a number of areas. So that is the reason why we purchased it. And we did say there's another 500,000 should come in during the course of February. And I did say that we're expecting other contributions that will be coming in, but we will only talk about them once that is confirmed. So we also anticipate that once we vaccinate some of the people, when you get additional doses, we will not wait for the 3 months for the designated for the phase. We can actually start some of the phases earlier because now there's a availability of a vaccine. I think we need to understand as well that there isn't a reason why government would slow the process of vaccination on its own, and then we end up with people dying as though that was the intention of the government. We all are here because of the people, and there isn't a way that anybody could realistically be making an accusation that so many people are going to die as though it is by design. Any life that we lose is because everything could have been done to try and save them, and therefore that it didn't work. And so our approach to the vaccination is going to be based on that. And I think we must be respectful of the approach, because the issue is that everybody needs to get the opportunity to get the vaccine that gets made available. And in the process, if we can get as many of those vaccines, that's exactly how we're going to have to deal with that issue. Then the question of Pfizer being a high cost, of course, we've negotiated it down, but because they were offering some availability, that was the issue. That made us to look at them. I did say that there are others that we're in negotiations with, but the price is a bit high. And on that basis, we have to really think carefully about what can we do. But the question at the end is going to be, will we avoid an expensive vaccine simply because it's expensive when it's available and we know that the efficacy is acceptable? So the answer is no. We can actually procure expensive vaccines provided they will be available earlier, and out of that process, we will then balance up. And that's why we said earlier, it's going to be a multiple supplier program that we're going to be taking. Then COVAX will actually tell us which particular vaccines that they have. They are the ones who determine. I think it's also based on what they've ordered and what is available early, and also depends on whether other countries would be able to manage the conditions that are associated with one vaccine. And therefore, you might find that they will say, okay, these countries can afford to manage this particular type of vaccine, so move more of those vaccines to that particular country. So they have given us a sense that at this point they would have been able to do 1 billion vaccines. But I think we need to realize that that is working much well for the rest of the other countries, because they are depending on donor communities. In our case, we're those countries that have to finance our own package through them. So we've actually said to them, look, what have you got that's available? They are also constrained by the availability that's coming from the manufacturers. Then your point, Ms. Wilson, Honorable Wilson, about vaccination report, we are moving towards that, so that on a regular basis, we're able to track how many people, and it should be public information as soon as our systems can do that, so that we don't have to discuss it in any way. But your concerns about webinars and media briefings, I'm sure you are not saying that we should not address the public and address meetings. But what we need to then do is to find a mechanism of how we can share information that you are interested in or are concerned about, even if we have not been able to go onto a meeting of this nature. I can hear all of us are saying that there is not enough time. I do agree there's not enough time, but there's also not enough time for this portfolio and other work that we have to do to try and keep a balance. But we can actually find a mechanism to keep sharing what questions the members have got, questions that we can ask, and we can try and provide as much of that information as it were. Honorable van Staden wanted us to give the Western Cape ability to go and buy their own vaccines. Well, let me say, if you are arguing like that because you're saying the ANC, the provinces run by the ANC are corrupt, then I think you're out of order. That's a politicking, and so we can argue about that. But let's deal with the possibility of a province buying vaccines. Now, let's leave the politics out. Let's deal with that. There are challenges that the province can face on that, and one of the challenges is the fact that one member said that, why was the letter from Treasury. Why did it come late in January? Well, that's because we've been involved in a lot of discussions about what the issues are that are arising in the procurement process. And once we came to a conclusion with Treasury, then we wrote a formal letter to say, okay, this is how we're going to deal with it. But there's been lots of discussion with Treasury long before then, and that letter and the dating of the letter has got no impact in terms of whether we were late or we're not late. It's got more of an impact on saying at which point were we able to get an agreement amongst ourselves in terms of the best way to manage a situation that we're dealing with. We have been dealing with these issues quite a while before, and between myself and Minister of Finance, we've been dealing with these issues. And so when you pick up one letter and you then say to prove something, I think we must forget that line of going to try and prove that the country has been delayed. I'm indicating right now that there are challenges in all the countries in the world, and therefore we need to understand that there would have been those situations where even as we approach the companies to try and procure the medication, things are not as smooth as what would have been expected. So the question then that comes for a province that needs to purchase their own vaccines is the fact that you will then are saying that Treasury must give the National Department of Health a deviation for procurement, and then they must each province must be given the same deviation. But you are saying we also want to avoid problems of corruption, but everyone must be given different deviations. So that becomes a bit of a problem. The second issue is that there's prepayment here. It's completely outside the PFMA. So prepayment means that you can't be saying everyone go prepay. You rather say, let's get a central acquisition and procure centrally, and then you then give a deviation for prepayment, and then you do that. When the agreements come, there's a huge amount of consultation and negotiation and discussion that needs to be done. If you are dealing you can imagine now you have one company, let's say Serum Institute or AstraZeneca, must now negotiate 9 different contracts for South Africa because each one of the provinces wants to go and buy their own, and this is a new program. So those are some of the practicalities. Then come to the conditions. Some of the conditions only the central government can take responsibility for. No provinces can be given that authority because they don't have. And therefore, those are the real issues which are practical. And let's leave the politicking out of the way, because most of the major manufacturers would rather deal with government because they can see the numbers are actually much safer like that. And you cannot get an individual who will sign an indemnity against what happens to a particular product on behalf of a population when the government has not participated in that. So there are tricky things that are involved. This is just a practical situation. So that Honorable Van Staden, you should understand, it's not the politics of who runs which province. It's the politics of global manufacturing companies and the dynamics of the vaccination manufacturing and the issues associated with that. So we have indicated the registration, the health workers have gone in there, but what we will not do, we've given you broad guidelines in terms of each phase will be 3 months, the other one 6 months, and so on. Those dates are going to change, and so I think allow us to work on the basis of a pragmatic approach that says if we find that they were ready earlier, we then move people to start. We can't say wait for 3 months because of that. If there's a knock-on effect from some problem and the things are delaying a little bit, then of course we'll explain that that is what will be happening. We gave a timeline of about 10 to 14 days, and we have said that we'll give exact data as soon as we can see that the issues are clear. The question of ivermectin, I will leave that. Dr. Anban will come into that. But the question of the safety of these vaccines, in any situation when you deal with therapeutic agents, vaccines, and so on, you should anticipate a few things. Firstly, that they would have gone through a rigorous scientific analysis that would indicate the level of safety. And in this case, we do have that. And therefore, Secondly, there will be a question. So unless there is safety, we will not actually take those vaccines. Secondly, the question of efficacy. That issue of efficacy is going to be very important because there is quite a degree of variations. Under various conditions, you might find the same vaccine might show different efficacy depending on various conditions. So we look very closely into that, and therefore when we make the choice. But largely, the vaccine that we are bringing are actually proven to be safe, and that for any other individual, there may well be certain responses or reactions that will come from the body. On their own, they don't mean that it is not safe. They basically mean that there are some idiosyncrasies in individuals who respond differently to the same agent, and therefore those are what we need to watch out for. So that, for me, is what we need to explain more and more and more to leaders, so that the leaders should not be the ones who are sending an information, who are sending a message of fear to our population, but that rather we must clear the issues so that everyone understands that this is what we're going to deal with. And we have said that the issues of corruption, we also want to invite members where you think or where you see or where you suspect there may well be some degree of corruption. Please, let's raise those issues and talk about them, and not fear that those issues should not be left as it were. Then that's the issue. That's the issue of safety that I think even Honorable Sheikh Mohammed said we must deal with. But I do welcome honorable members' offer that they would be ready to take the vaccine and make sure that we can lead by example to our communities. I have explained why, when you've got efficacy of 90, why would you buy another vaccine that's got efficacy a bit lower? That's because it's acceptable. WHO would require efficacy of more than 50%. And in our case, if there's anything that is a bit lower but is available and the conditions of its storage and maintenance are possible, then of course we will do that. But if the vaccine is expensive, and then of course you've got to consider the issues of availability as well. But if there's efficacy of 90, you can still take anyone that has got a bit of a lower efficacy. There is a limit, though, to how far you can do with that. We can go with that. The confidentiality issues are standard in any commercial transaction. When we talk about transparency, we should not conflate the two issues. Transparency means we need to explain what we did. And therefore, that means we can actually make public what would have been the conditions under which we signed for a particular vaccine, and then you can be aware of that. We'll explain why we did that. And on the other hand, it doesn't mean that whilst you are busy negotiating, you should actually be going out to the media to say, well, we asked for $10, they've said no, they want to give it $15 and so on. So there are these issues, but you also consider that we might argue on a basis of special consideration that we don't want anyone else to be aware of, because that's the nature of the negotiation. So that's why they are confidential, but there's nothing devious to us about it. It's a question. There are instances, though, which I think we must be aware that there are conditions which, if we're going to be, that we might not have liked, but we might have to sign, such as the issues of indemnities, because if you don't do so, everyone else in the world is doing it, and therefore you might find it difficult to actually even procure the the order that you wanted to take you wanted to place. So for that reason, there are specific things that you have to do. You do a lot of negotiations and then settle at some point. So once you've settled, you must say why we settled. That's transparency for us. Then I did say that some of the negative reports that are coming from different countries, we will note. So, for example, we have noted the issue from Denmark and Norway and so on about over 60 years and with AstraZeneca. We have to note those and then follow. We have noted some of the reports about people who had died after the Pfizer vaccine and so on. It's just that every incident that happens on someone who has got the vaccine needs to be reported. It's another question to assign the causation of death to the vaccine as opposed to the association, because once someone has had a vaccine, we need to know, are they coughing? If they are coughing, you want to know whether that could be, there are many people who are coughing, because then there might be an issue around the cough, only to find that this one was a simple cold. Then somebody died, yes, they've died. What was the problem? What did they have? So that has to be analyzed as well. So I think we mustn't get too anxious about those reports. We must wait for something that's concrete, that indicates the link between the vaccine and that particular situation. If you can look at the register of how people are reported, you will find lots of things that are completely unrelated to the vaccine that must be reported as a matter of the accuracy that is needed. But that doesn't necessarily mean that you are dealing with the cause of death is that particular vaccine. So we are open as we deal with it, and we're following what happens in the rest of the other countries. Then, of course, we have raised the issues about the SMMEs, that the conditions are going to be the same. The conditions are that we need to make sure that people qualify to be able to deliver the services and maintain the safety in terms of physical safety, no theft, and also there should be maintenance of the cold chain and all of those issues. That will all be public, so everyone will have to go through that process. Then the others have argued that you must actually build the state capacity for that. Because it's a new program, we have not had as much capacity. We're also looking into what some of the state-owned entities can do. Can Transnet assist in that? We haven't got any clear answers, but if they can offer, then of course we can deal with that. So it's a question of a balance of where we get the best service at this point. Then the question was raised by Honorable Ismail about power shortage. This is an issue that we have to deal with. In some of the instances where there's a power shortage, there will be hospitals that have got generators that we expect to kick in as soon as there might be an interruption of electricity. Some of the packages for storing the vaccines have got batteries that maintain the cold chain for a particular period that have got to be protected. So that all of those issues are part of what we're going to be doing. But also in some of the vaccines, you move it away from -70. Once you start using it, you can store it for a limited number of days on a normal fridge, and therefore it may not be damaged immediately. So all of those are going to go into the lesson, the training of our staff. Why not buy from Aspen directly? Well, there's a bit of a difference between what Aspen and the Serum Institute of India is. AstraZeneca with the Serum Institute of India has given them the license to manufacture, so you can order straight from that particular company. Whereas Aspen is doing a filling and finishing role for J&J, and they are contracted. They don't have the leeway to actually get into their own independent contracts, but you have to do so with Johnson & Johnson. However, we are engaged with a lot with them, because we are happy that Aspen builds a capacity inside South Africa to play a role in the vaccine manufacturing. We believe that they can go further to a point where they can manufacture the entire value chain. But at the same time, we are also discussing with Johnson & Johnson that a lot of the vaccines that are being manufactured here, the entire continent is looking at what proportion of those is actually going to service the continent, and there's been a lot of discussion and agreements on those. It's not my space to report on that, but just to say that engagement is taking place, but you can't buy directly from Aspen. We deal with the global Johnson & Johnson, and we're dealing with them literally every second day, dealing with a very pertinent issue that relate to this. So it's an important issue to say nothing is bypassing us unaware. We are actually working very closely with all of this. So the basis of which suppliers we approach is based on availability. Well, firstly, safety, efficacy, availability. Then beyond that point is going to be a question of price, convenience, and all of those things. So that whole package and stuff that we deal with. I still want to insist that this is 2021, where most of the countries are going to be vaccinating most of their population. Whether a country started in November or December or January or February, the forecast is this is 2021. So we must really not keep thinking that we are so late. There are many countries that haven't started. There are countries that are starting and stopping. So there are lots of issues that have to be taken into account. I still believe that South Africa has actually received the best that we can under the circumstances, and there will obviously be more and more effort to accelerate the acquisition of more vaccines. And as things are going to be unfolding, we'll be making public announcements about them. If there's still time, we could actually ask Dr. Anban Pillay to respond on the issues around ivermectin and some of the ones that I might have left out. Thank you very much, Chairperson.
Thank you, Chair. Thank you, Minister and honourable members. If I can just quickly deal with the ivermectin issues. So I think it's important to state that SAPRA is mandated to address the issue of ivermectin. The National Department doesn't have a specific role in the registration or evaluation of the product. I have been talking to SAPRA, and they have indicated that they will certainly be licensing GMP facilities to supply the ivermectin. I understand that there are about 3 suppliers that could potentially supply ivermectin of a grade that may be acceptable to SAPRA, and hopefully we would see a progress on that matter going forward. In terms of having a set price for the ivermectin, I think that's something we would engage with those suppliers once we get more information about who those suppliers are and what the pricing is around that. I think that will emerge over time. If I can also just address the question around the vaccine efficacy, I think it's important to appreciate that the percentages that you see around the vaccine relate to the efficacy in mild to moderate infection, where people report symptoms, etc. What's important in vaccination, or should be very important, is whether the vaccine can prevent hospitalization and death. And if you look at all of the vaccines, they more or less are equally effective on that score. So I think at the end of the day, our greatest interest is to prevent hospitalization and death. Whether you have slightly more symptoms or slightly less symptoms is less of an issue, I think, relative to the efficacy of vaccines. The question around the tracking of vaccines, well, the IT system that we've put in place requires that the batch number and the product details are captured within the IT system, and barcoding will also be incorporated within that, so that we'll be able to track the vaccine and make sure that the vaccine that has been administered to a patient is a vaccine that we actually procured and is a legitimate vaccine. So I think certainly that will be part of our system. In terms of the using 2 different doses on the same patient, or 2 different products on the same patient, that would be difficult to do simply because the IT system, when you receive your first dose, they will capture the details of which vaccine you received. And so you will receive a reminder to go back and get your second dose, and that's the doses that will be distributed to that facility. So they shouldn't, that shouldn't happen in terms of the delivery. The question about which vaccines will COVAX supply, currently they have deals with Pfizer and they have deals with AstraZeneca, and those are the 2 vaccines you would have seen that they've indicated they will supply to us. They're also indicated they're talking to Johnson & Johnson, and we anticipate that later in the year that Johnson & Johnson vaccines will become available through the COVAX facility. Just on the question relating to the arrival date of the AstraZeneca vaccine from Serum Institute, I think it's important to bear in mind that the vaccine delivery date and the commencement of vaccination are different. And we put in the 500,000 in March simply because we're not exactly sure on the exact date of delivery. And to be safe, we thought we will rather allocate that to the month of March than allocate it to February, because at this stage, we don't have an exact delivery date from the Serum Institute itself. I think on the question about the Pfizer vaccine, the minister's answered that about the cold storage. We've been able to get a fair bit of support from some of the universities who have -70-degree fridges. So we would probably be able to borrow some of those and keep them as vaccine storage for a temporary period of time. Thank you, Minister. I think those were the key questions I was required to respond to.
Okay. The Minister had indicated that he would probably like to take another appointment, but I noticed that in the platform here there's a DG, Dr. Buthelezi, the Deputy Minister, Dr. Pasha, Dr. Aquina Tulare, and even Ian van der Merwe, the CFO who's negotiating with the National Treasury. Any one of you would like to add on or say something before there are some members who would like to ask follow-up questions, 2 or 3, and I've checked with them. They said they will be happy even if a minister is not here now. They would want to make a follow-up. Maybe let me check if I could apply for that. Right until at least close to at 4 o'clock, we might be wrapping up. Okay, let me start with the follow-up questions. Honorable Wilson, followed by Honorable Imam Sheikh. Those are the 2 who have indicated so far. If there's any other one, you'll come after Honorable Imam Sheikh, but let's start with Honorable Wilson now.
Thank you, Chairperson, and I appreciate it. Thank you, Dr. Pillay and Dr. Buthelezi. I'm glad that you're still on the format, and perhaps you can assist me with these answers. I literally have sort of one follow-up question, a couple of issues linked to one question. I think I want to state from the outset, the minister mentioned that, they sometimes get the feeling that we are stating that these delays in the vaccines and the holdups and etc. are by design. Please understand, under no circumstances are we saying this is by design. That is a thought or indication of something I don't think we should even be thinking about. What we are saying is that we will slow out of the start. And that maybe some of these issues with vaccine should have been addressed earlier rather than as late as they were. And around that question of vaccines, and I'm going back to the minister's presentation, particularly where he has listed the amount of vaccines, from where they are coming and in what numbers they are coming. Oh, welcome, Minister. Nice to see you. This is where I need the clarity. Minister, you are saying that the vaccines are ordered on confirmed availability. So what I'm asking then, in this presentation that you've given us, the 20 million from Pfizer and the 9,000 from 9 million from COVAX or J&J, AstraZeneca, whatever they are, how realistic are these figures? Have we entered into contract with them? Have any payments been made to these companies? What level of negotiation are we at, or are these thumbsuck figures? Because I get very concerned when you say, well, this has still got to be done, that's still got to be done, etc. has got to be done. It sounds, then it makes these figures appear that they are thumbsuck. And I think that is my biggest concern here. That and the fact that if there are thumbsuck figures, and we know that even by January next year, we will not have got enough vaccines to create a herd immunity. These vaccines are going to arrive very slowly, and I know that you say it's a moving target and may be available tomorrow. But in order for us to hold the department accountable, we need some clarity on exactly where we are. If you grasp what I'm trying to say, Minister, I see you nodding your head. Thank you.
Okay, Honorable Imam Sheikh will be followed by the last hand, Honorable Van Staden. Those 3.
Yeah, thank you very much, Chair, and thank you, Minister. I think one of the few ministers who comes here and gives us a comprehensive response, and thank you very much for that. Minister, my one question, however, not answered. How is it that you went ahead as your department and procured these vaccines without getting due or timeous authorization? Up to now, according to SAPRA, there is no Section 21 applications or anything for most of these vaccines that are going to come in. And so how is it that we already go and order something and procure it without due authorization. The second thing is this: in terms of this vaccine, many of these companies or organizations raised their concern that they have been running after your department for a long time from last year to try and negotiate on these vaccines, and you only came to them in January. Now, I don't know if you've partially answered that, if it was because of financial constraints and you needed to get the go-ahead and things from Treasury and things. If that is the case, then one can understand that. But just finally, I'm not satisfied with the response I'm getting in terms of the ivermectin, because SAPRA is saying we only register on application. They are saying it is others, and our understanding is the NDOH should be in the forefront of reviewing data, putting some pressure, asking them to review it, get people to do applications, look at the stats that's coming. Now, between the two of you, somewhere there seems to be a lack of communication as to whose responsibility, who is the custodians of the health of the people in this country. Maybe that clarity will take us a long way into be able to resolve not only this, but future incidences of this nature. Thank you.
Honorable Van Staden, the last one.
Thank you, Honorable Chairperson, Honorable Minister. Now I have one last question to the Minister. Why I'm asking this question is, but I, as a citizen of this country, is worried that this problem I'm going to raise now will have a very big impact on the vaccination process and the rollout process, therefore. Honorable Minister, according to reports that was published last Sunday, there are about 40,000 government posts for experienced doctors and specialists frozen due to a lack of money. And we have seen over the past year what impact this was having on our state hospitals due to a lack of doctors and nurses. Now, in the Eastern Cape, 625 nurses are without a job due to the department that don't have the money to pay for their salaries. We have seen over the past year the problems that occurred in the Eastern Cape state hospitals. Now, this past Wednesday, doctors and healthcare workers protested outside the Harry City Hospital in Appington in the Northern Cape due to a shortage of staff. Now, doctors at this hospital is under tremendous pressure and are overworked and tired. Now, this hospital is a district hospital, as you know, with 327 beds, with, if I'm correctly, only 36 doctors currently. Now, doctors are working 40 hours a week with 20 hours overtime, but they do not get paid if they work longer hours to help in the fight against this pandemic. Now, there is also simply not enough staff to help these doctors, and thus the management of a hospital must, as far as possible, limit the need for overtime and use it only in the event of a shortage of staff. And then in the Eastern Cape, that same department in 2020 paid 60 million rand to false overtime claims that was handed in at the department. My question, Honourable Minister, is how will your department address these issues that is now spreading across the country? How will your department see to it that the problems with appointment of interns will be eradicated? And what plans will you and your department put in place to see to it that enough doctors, nurses, and healthcare workers will be appointed across the country to help in the fight against the pandemic, to help with the rollout of a vaccine plan, and when can and will these appointments start to take place? Thank you, Honourable Chairperson. Thank you, Honourable Minister.
There's the last one. Honourable Minister, I was not aware you are still in, but thanks for holding on. You will indicate when you want to leave the meeting. Thanks.
Thank you very much, Honourable Chairperson. Let me start with the last question that's been raised by Honourable Van Staden. I have seen the numbers that are published, very high numbers, and the numbers, we don't have a shortage of 40,000 doctors. Now, the real issue is that we do have challenges of human resources. Firstly, there are a number of provinces that do get problems, and in the past year, we went around to the different provinces, even to the extent of employing contracted doctors and nurses to be able to deal with the issue of COVID-19. We will continue that approach to make sure that there is immediate availability of doctors. Now, there was an issue raised that there is a list of unemployed doctors. then I'd actually asked that the Medical Association, together with a team in the department, they must look at that list so that at that time we must then deal with that. For a long time, we couldn't quite get the numbers that were unemployed out there. So the issue of the shortage of doctors and the lack and unemployment usually comes in different ways. Firstly, a number of interns, when they have not been given allocation by December sometime, they panic and then they start tweeting and complaining that they have not been placed, and it becomes a problem. So when that happens, members think that that means that we're not employing those, whereas it's a matter of a time delay that would have been part of it. The second group would be doctors who are employed as community health, community service doctors. Before the end of their term, they would sometimes panic to say where are they getting employment. And in a number of instances, that issue becomes quite emotive at the point when we deal with it. Last year, we had the same situation, and then I actually called all the MECs and asked them to declare all the unemployed, the vacancies and so on. Then I found that there was always a problem. The provinces aren't in the same situation. In Gauteng, for example, they had actually issued out a call for doctors to come for interviews, and they couldn't fill the numbers of posts because the doctors did not apply in the large numbers. And the fact there was no automatic translation that someone was in community service, therefore they were prepared to stay in the public service after that. A number of them wanted to move into the private sector. So it's an issue that you have to manage on a day-to-day basis as you move on. So your question is that what about in the Northern Cape? There we have a different challenge, and the challenge is the fact that the area is a bit, it's away from the main centers, main cities, so it tends to suffer the reluctance of members to go there. Rural areas have the same problem. That's now and again the reason why you get the same problem in the Eastern Cape. So where you find that some of the small hospitals, the doctors, there's no doctors, there are not enough doctors, because the people tend to move towards the urban areas. So it's an issue that we have to deal with. And in some of the instances, we've had a problem of when there are financial constraints, then the province would now say they are forced to do freezing of the posts. And then sometimes those posts would be health-related posts. So in the Eastern Cape, for example, we had a big discussion where I then said to them, okay, how many doctors, how many nurses are short? And then they said, actually, we have corrected the issue of doctors and nurses. Now we're short of porters and cleaners and general workers, general assistants. So it's an issue that we have to deal with on a continuous basis. And how we decided to deal with it was to go and sponsor the creation, the development of a human resource strategy that's really futuristic. Now that strategy takes into account the current vacancies, it takes into account the population growth and some norms that we have debated quite strongly whether in fact they are suitable, they are appropriate or not. And therefore it begins to create a future projection of what we might need in so many years to come in the future. So those projections can be misinterpreted as to mean we're having a shortfall now. But those projections also mean that we have to move from the current establishment and change that, revise it to a higher level of human resource establishment. So all of those issues are issues that are part of this discussion. So we are managing it as I've indicated, and we are actually saying to the hospitals, to the provinces, where particularly where we've got pressure of COVID-19, we can't run out of doctors or nurses. You might have heard at some point the Minister of Finance saying that in public, to say there can't be a situation where there are doctors who say they can't be paid because there's no money, they can't be employed because there's no money. So that is really where we are on that particular issue. Then the question of ivermectin. Now, I don't quite know how we must deal with this. Honorable Sheikh Imam, the issue is that there are certain divisions of responsibilities. Now, when it comes to the issues of registration, most of the issues that you have been raising all along around the question of ivermectin fall squarely on the hands of the regulator who has the mandate to deal with the issues of registration, approval, looking at efficacy, available data, and whether the reports about the individual therapeutic agent are actually accepted as properly peer-reviewed and all of that. So we can't both do the same thing. So that is, it's SAPRA that must do that. And secondly, when there are trials that need to be done, what then happens is that the different research institutions, academic institutions, will get involved in the research and go and do the research. For them to do the research, they've got to go via SAPRA to ask for authorization under special circumstances to do that, and then we will get the results. When those results come out, they might indicate that a particular drug is useful for a particular purpose, but that is not the responsibility of that particular researcher to go and register the drug. It would then have to be the responsibility of the developer, the manufacturer, the one who sells the drug, to be the one who must go and apply for the drug to be registered. So on the one side, there are institutions who have had their interest from the University of Free State, I think, and others, to actually do more work on the area of ivermectin, because whilst we have had a lot of questions raised on ivermectin, what we needed is a double-blind trial that must then, on the basis of a very thorough scientific process, then prove the value of ivermectin. The risk of stampeding a process to just because there's a public outcry when there is no scientific proper scientific process is that most of the trials that get done, when they are done, they'll do what we call blind trials, which means then one arm is given placebo, the other arm is given the agent, but the researchers got no idea what works, and then they'll just report the clinical manifestations of the disease, and they look at the improvement and look at various parameters and put them out there. Only once there's unblinding of the results of the two agents, then you know what was the difference between the two and which one did what and so on. We haven't got that here in the case of the ivermectin. Now, the problem is that the issue of ivermectin arose at a time when the surge was very high. Now, that is a problem because everybody is anxious. You can't sit here when someone tells you there's something that works next door and you don't want to use it. That's why we understand why everybody was out there making a big call about ivermectin. Others call it a vaccine, others call it a cure, others call it a prevention, and so on and so on. Now, the issue is that when there is a crisis of the surge like we went through, people are going to be desperate. But that does not mean that when people are desperate, even the scientists must also be emotional about dealing with the issue. They must fast-track the process. But fast-tracking the process is a scientific process. That means that they don't skip, they don't take shortcuts. But we are allowed. We see we are humans. If we say, no, please help us, give us whatever works, doesn't matter what it is, I'll try. That's what this whole call was about. It's not that we didn't understand it, we do. However, we now need to make sure that the professional, technical, scientific approach must be followed. So as we stand now, we have got the process that SAPRA has put into place, and that process is a safe process because it puts the doctor to be responsible for watching out what happens to the patient after they're given the medication. What SAPRA is allowed to happen, you must get the drug early so that you are able to oversee it and supervise it, and then make sure that you still take responsibility. So if your patient decides to come back and sue you for the negative adverse effects of the drug, then of course it's a matter between the attending doctor and the patient. But you can't then go and say, okay, government and SAPRA, you have recommended this drug, because we would then say, no, we didn't mislead you to say it is correct, it's safe, it's working. We said your doctor knows best, and therefore we'll support your doctor to allow the process in. So now we do go and review various analyses and papers and so on, and take certain policy decisions. This one came at a very rapid pace. The review that was done by the, I think, CDC or NIH let's say NIH in the United States, I think they did one around September. Now, a number of doctors from the United States were out there talking to the senators and saying, this thing needs to be reviewed. But then somebody said, oh, but this was just recently reviewed. He said, oh, this is December, you know, that was done in September. Normally, that's a very short time for any of these processes. It normally takes long. But this year, we've seen things happening at a very fast pace. To see a pandemic arising within 12 months, that pandemic has killed so many people, and at the same time has also got a vaccine in place that's being tried and is actually being deployed to communities, to individuals. It's something new. So out of this process, we have seen a lot of things being done, but we can't conflate the roles. I think the point you are making, we need to understand when people are desperate and are worried and see what can be done, but it doesn't mean that we must conflate the roles of what each of the players should be. Then you've asked another very interesting question: why order before authorization? The question that was asked by Honorable Wilson, why delay so late? Why did you order all along? So the two of you are asking us two different questions that are contradictory. Now, it's not that we are having a problem with that. What we're saying is that there was a time when there was so much uncertainty that you couldn't commit much. Then with time, there's been a lot of new information. So there's an anticipation of what the outcomes would be. And therefore, some of the, for example, of the drugs, for example, some of the vaccines, for example, have been tried in different countries. Some we actually started negotiating and ordering even before we knew the official efficacy announcement. But that is because there's been a short listing of the vaccines, and therefore we can then play, take what we could call an educated guess as to what may work, because our scientists are reading a whole lot of other papers and giving us a guide to say, you won't be too wrong if you went for this particular vaccine. So that's what we've had to do. However, once we place the order, we also have an option that if we know that the drug works, then government can stand in and be the one that applies for the vaccine to be imported under the name of the government. So then the approval is given on a temporary basis or on a conditional basis because of that. So it is not wrong, it is correct. We can do it. So, but in this case, for example, the government was the one that applied for AstraZeneca to be imported. It is within the law, and everything has been done appropriately and according to according to the book. But if next year AstraZeneca wants to do the importing themselves, they could also apply and say, "Oh, we will do the one." And government said, "We're no longer interested in importing, so our authorization lapses." And then someone else wants to do it, so they'll have to do it like that. So that's what the process is. So there's nothing wrong in what we're doing. What we're basically saying is that all of these processes have to be done at the same time. For most of the vaccines that we're going to get, we're going to use various procedures to bring those vaccines in. Some of the vaccines have been brought in under the guise of the research. Those vaccines have come up, and the particular application was done by those who are running the research. It's still acceptable. And then others will come because the manufacturer will apply. The others will come because the government has applied. But we order before, and then we will then, it will be delivered once there's authorization. You can never get any vaccine into the country without proper authorization by the regulator, and that's the way we deal with it. Then, then the questions that are raised by Honorable Wilson, I do understand. Look, Honorable Wilson, I think you've put the issue of delay in such a way that we leave it to the opinions now. We have a view that we haven't delayed. You have a view that we delayed. It's almost like we may not necessarily agree on it, but that's fine. That's your view. That's my view. That's how we deal with it. We deal with it in that kind of view. But you are raising also a very interesting issues. What are these specifics? Now, when we negotiate with a company, we first ask them if they've got the staff and we're interested, and they say yes. And then we say, okay, we're interested. They say we can't go into details. First, let's agree that you are going to have a non-disclosure. So whatever we discuss with you, don't go share with others who are doing other things, either other people who are potential procurers or people who are selling other things. So we have an understanding. There are conditions that are specific to our company. That's why we would want you to keep them confidential. Once we have agreed, you can tell whoever, but right now, please keep them like that. So that's what happened. So then we sign that non-disclosure. Then we say, okay, they say, okay, what are you looking for? Then we say, we're looking for X amount. They say, well, maybe we may not have so much X amount, but because you are prepared to buy, we will offer you so much, or you tell us how much, then we can structure it. Then you get a kind of heads of agreement kind of things, or some kind of terms under which you will agree. All that will say is that we are committing that once you've paid, once you have signed the detailed agreement, once we have manufactured, we will deliver to you. Then we can say broadly in terms of our capacity, so much might be available by this term, by this quarter, which is quarter one, so much could be available on quarter two, but you can't have all of it on quarter two. It will all go to quarter three and quarter four. So broadly, that's what it might come out to be. But we will not proceed until you sign the detailed agreement. The detailed agreement says you are going to pay before we give you the stuff. Then secondly, it then says after you have paid, then these are the possible, right, once you have paid, we'll give you possible monthly numbers of what we will supply and make available to you. Then you then find that in the process, the issue of what they will give you will only be clear beyond the quarter. It will be clearer when they have a fully signed detailed agreement that gives you schedule on a month to month in terms of the amount. So the Serum Institute, when we announced it, we had signed the agreement for a purchase, which is basically we have agreed that the order is going to be processed. Then after that, then they said, we will tell you once you pay when the date are. So Mr. Honorable Wilson says, okay, give us a date. When is Serum Institute going to give you? But Serum Institute has still not given us the date because they say, we're waiting for your payment. Once the payment comes, then they say, okay, we're going to deliver on such a date. That's how it happens. So now on Serum Institute, we are done because there's another bit that's coming in February. Now let's talk about Pfizer, for example. Pfizer, where we are, we have an agreement that they will supply us 20 million doses. They have said so. They have told us the price, but the price they've given us is really an indicative price on the basis that that's what we think. We don't know the rands and cents about it, the dots and cents about it. However, what it says is that we then have to deal with the other conditions precedent to the conclusion of this deal. That takes a while because then we say we don't like this condition. And they say, well, we can change that. Then we say we don't like this one. They say, well, that one we can't change. And so that's the argument that goes to and fro. Let's say now we then agree that, okay, this we can't change. Then we must now leave that process and go and sit down with Treasury. They say, Treasury, give us deviations to cover 1, 2, 3, 4. Then Treasury says, okay, that process means such a committee must sit, that committee must discuss, that authority must be obtained. Then you wait for that process. It's a normal way of how we do work in government. Once you got that done and we have got this agreement, then you say to the company, listen, at this point, we're ready to sign, but give us the details of the agreement, because those were just principles of the agreement. Now I want to see the details. Then they say, okay, wait, because our lawyers are now refining this thing specific to your country. This was a principal issue. Now it's a contract for you. So that you wait. Now our lawyers are busy. There's this and that. That's why you get a delay. But now what is confirmed, we will get the 20 million. Have we paid? No. But have we got the money? We've gone to Treasury. We now know we'll have the money. So when we say to you, wait, because we still got that, that's really what tends to be happening. So all of these issues that you are raising, there is no thumbs up on the figures we're giving you. Those figures are based on the best we can get out of the discussion with the companies. Where we have possible estimations, we haven't given you those numbers. In that column, the column that says shortfall, that column basically is, and I was saying to my team, it's misleading to say shortfall, because we have negotiations that are going on that issue, but we're not at liberty to divulge, because there's a whole lot of more, toing and froing. In some instances, we have to go and talk to this company, we have to go talk to COVAX, go talk to AVAT Group, go talk to the company, and then check what is the best way out of it. And when you find out that this is the way we're going to go for it, then we say we will settle this one. But whilst we have not got the first agreement that says you will get so many, we can't announce. So COVAX, we have agreed. They will give us the dosages there, because we've got that whole area paid for. But ask them which vaccines. They say wait, because the distribution of all of these vaccines is not well confirmed. We still have to distribute across various countries, whatever proportions, and so on and so on. We also want to ask you about your readiness. Who is ready for this vaccine? Who is not ready for this vaccine? For example, COVAX would send to us and say, how much of this vaccine can you handle? We give them a response. They don't come back, because they still got to check with the rest of the others. So when the members of parliament are saying, but where are the dates here? The dates are not there because the manufacturer hasn't given the dates, and the manufacturer will give us the dates once they are satisfied that the agreement is structured for our purposes, and we have agreed on the conditions, and we have got the exemption from Treasury, and so on. That process is how government works. You don't need to bother about it, because at the back office, that's the stuff we do. But somebody wants to get the answer of what's going on in the back office. Why is it quiet? This government is not transparent, is not telling us, and so on. So those are the kind of things that we're dealing with. So when we then come back next time and we say, oh, there's this and that, that's going to be different, but you didn't tell us about that. That's because the thing was not confirmed. When we come back and say it's changed now because it's confirmed. So that's it. Now you have asked me the question in a manner that makes me understand exactly where you're coming from and what you're trying to get, because I have not been quite understanding what exactly is happening. Sometimes we take this process a bit for granted. You will not believe how many meetings we'll have with the global CEO and all the top members of the current ones that we're busy dealing with. There's a lot of discussion and so on, and sometimes we are pushing them. No, you can't supply so late, give us more. They said this thing is finished. Then somebody says, oh, maybe they might be having something somewhere. Go back to them. You understand? Then we go back to them and say, no. They say, well, there's an arrangement that can be made, and so on and so on. That's the kind of thing that we're dealing with. If that helps, I hope it does clarify some of the issues. So there will be information that you want, which we'll readily give. There'll be information that we are not ready. There'll be information that's unavailable, and that just trust us that when that information is available, we'll come up with it. And then, of course, to deal with your issue of concern about some of the questions that come to the media, I think what you need, Honorable Chairperson, is that, you see what the media does, they rely on gossips. So somebody then says, this was asked by Honorable Sheikh Imam, somebody says, well, you know, those guys are giving us a runaround. What they are doing, they're basically trying to pitch a sale, and they're using members of parliament and media to put pressure on us. Okay, and that's what happens. In this case, then I pick up a call and I call the CEO or the director and say, how come your people are telling this about us? They said, well, you know, we don't know who's saying it. And said, okay, issue a statement. They said, well, you know, we issue a statement, but the statement doesn't get carried because it's not an interesting story. So there have been areas where we've actually asked the organization. For example, we asked, I think somebody was quoted as saying that there was a source that said that, oh, Pfizer, we disappeared and they're having a difficulty working with the South African government. So I called them and I asked them, guys, why didn't you tell us you've got difficulty dealing with us? They said we were quite embarrassed and disappointed that someone has done that. But I'm not their spokesperson, you see. So I can't be coming to you to explain what they have said to me. The reality is that people will go out there and tell stories. Now, if you say someone we know it from a good source, a journalist will swear by the source as correct. When we come here and we want to ask where's the evidence of that, nobody will give us, but the story won't change. So that's part of the area that we were operating in. We do understand that. So there will be mistakes, there will be information, there will be disinformation, there will be all sorts of things. We can't always explain it, but when you ask us, we can explain on this one, on this one, on this one. Right now, there are lots of questions about, oh, we hear that there's an offer that's come from Moderna. There's some media that's asked that question. Now, how do we start talking about what we're discussing with a company that we're actually under non-disclosure about? And we know that nothing concrete has been concluded, and therefore we might be at a sensitive stage. We might be getting close to concluding the issues. We might be going through lots of discussion internally, all of that. So when you get to raise those questions, we will respond, but we may not necessarily be saying that what you get from what the media will report, we need to talk about, but not really, because all of it is as correct as what we might be seeing. The media will pick up the issue, then we'll tell them, no, this is not correct, this is not correct. Sometimes that doesn't appear. And so the environment, because of the nature of the pandemic, is such that any news, people pick it up and run with it, and they get concerned because everybody wants to know, when do we get rid of this problem of the pandemic? As long as we have not gotten rid of the pandemic, we're going to have to deal with disinformation, we're going to deal with delays, we're going to deal with contestation, people are going to be trying to get a shortcut to getting some money. I was shocked to see the story about Chinese fake vaccines, that people went and created something that they wanted to sell. Now, again, for me, one of the ways of avoiding that is to make sure that we authenticate whoever gives us the stuff and we take it through. So all of those issues, I think, from the honorable members, I do understand that some of these questions become problematic to you. Let's find a way of how can we share the information, even if we don't have a sitting like this one. Thank you very much, Honorable Chairperson.
Honorable members, we have gone way over the time that was allocated, not just by me, but by Parliament for this meeting. Thanks to the Minister. There's a saying in Zulu, I'm going to ask Honorable Kwahube to interpret it in English. There's a saying in Zulu that says, "Indlela ibuzwa kwabaphambili." Now, here in COVID, there is no cause that is way ahead of us. All of us in the world learn doing the same. So that's how I've learned sometimes to be a bit patient with some of these challenges, because it's a new wave in the whole world, and every day is going to be a new issue. Nobody has got much more experience than anyone in the world on these issues. But thanks for the engagement with the Minister. And Minister, you can see the appetite of members wanting to engage with you. I'm still getting messages here that I said, no, we will not have to continue longer. We have to bring this close, because I've been advised and warned by parliamentary staff that they've been pleading to keep more minutes, and this meeting has to really come to a close today. Honorable members, we meet again next week on Wednesday for another portfolio committee meeting. Have a good weekend. Thank you, Minister, and your team. That was a big team that you brought together. Thank you very much.
Thank you very much.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair. Thank you, Minister. Thank you, team.
Thank you, Chair.
Yeah.